Well, the DaVinci is a new state-of-the-art device that's actually been around for better than 5 years now, but the DaVinci SI that we have at the hospital is the most advanced robot on the market. What it brings to the table is high-definition 3D imaging of the inside of the abdomen, which can help with visualization of nerves and vessels, etc. The other thing that it does is it often cuts down blood loss in many cases. So it brings a lot to the table from that standpoint. It is more minimally invasive from the standpoint of the fact you can do very complex procedures in a laparoscopic manner as opposed to making an incision. There are certain procedures that it definitely is a much better option than getting an incision. It's used most frequently in urology with prostates. Virtually every procedure that can be done urologically has been done robotically at this point. So it's really taken off in my field as a necessary tool.